I might have to defer to some of our staff members here. Bill, do you know the first case in terms of travel?
I'll have to pull that. I
All
didn't
right.
bring that with me.
I believe that I believe both were out of travelers that had visited other countries, and came into the United States.
Kaylee's here if you want her to.
Yeah, wait, Kaylee, why don't you come up and introduce yourself?
Do you know where they traveled out of the country?
I believe one was Vancouver, and Kaylee, do we know the other?
The other one was a passenger on a cruise ship.
We were late. Could you just say the beginning over again, just the headline here?
Yeah, so we have two presumptive confirmed COVID-19 cases in Denver. I refer to them as presumptive cases because there's a two-step process in confirming whether a person actually has COVID-19. One is at the state level, and both persons tested positive at the state level. That'll be confirmed by the CDC. Those samples have been shipped off to the CDC, and it's generally a 24 to 48-hour process for the CDC to confirm those.
So maybe start with the person who went to Vancouver, man, woman, age. What can you tell us about that person?
Yeah, again, I won't speak to that, Brian. You know, if you want general questions about what we're doing, if you have general questions about what we're doing, high-level questions about were they out of state, happy to answer those
So
questions.
did they travel publicly? Were they in any big areas, DIA, Pepsi Center, malls, that kind of thing in the city?
No, we don't. There were some close contacts that we're monitoring, but we are not concerned at the time about being infectious and in contact with large amounts of people.
The release said there were several other people that would possibly be quarantined. How many other people are being quarantined at this moment in time?
Well, let's understand what that means when we say quarantine. A person can be quarantined for a number of reasons. They could be quarantined because they are tested positive or under suspicion. And so we have a few people who have been quarantined because we're monitoring them, but not because they fit the definition of somebody who would want to monitor because of travel or things like that. But there's no reason to suspect that other people that we've quarantined, it's been limited, that they're going to be positive.
How many other people when you say few?
I think it's less than a dozen.
And are those, just to be clear, because it was just in the news release that way, are those other people who are quarantined, are they quarantined because they were associated with these two people, or is it separate from that?
A couple of them are, but not everyone.
Okay, so a couple of them are quarantined because they were associated with these two travelers.
That's correct.
But the other 10-ish are quarantined just because?
I don't know if I know the details of why the other way, you know, they met the criteria for monitoring them because of travel, or do you have details on that?
Yeah, so we have a few categories of folks, and so we have close contacts. When we have presumptive positive cases, we issue quarantine orders to their close contacts, so people that spent extended time with them while they were symptomatic. The other quarantine folks that we have are ones that meet some sort of travel history, or they had another type of exposure, maybe with an out-of-state confirmed case.
And I apologize, I missed the beginning of this, so I'm sorry. These two cases, because one is from Vancouver, one is from a cruise ship, have nothing to do with the Summit County case, correct?
That's correct.
Just wanted to double check. Is there any reason why there isn't any more information being released about these individuals?
Well, there are certainly some restrictions in terms of what we can share about individual patients. So we do have to follow those guidelines, but we're not trying to hide anything. There's nothing bigger going on here. And the other thing is that with these cases, there's a very detailed interview process and an investigation process to make sure that we have everything under control. And I believe that it's being handled properly. We have it under control. The people that we are concerned with, we're monitoring. But we're not withholding information for any other reason other than we want to be careful that we don't release information that's premature.
What was the cruise ship?
Yeah.
I don't know that we have that information yet. These were folks who reported to us. They weren't on any kind of monitoring list.
So they self-reported?
They self-report, and we, since they weren't symptomatic while on the cruise ship, we don't need to take any further action.
So you know where they got tested? Did they walk into like an area hospital or somewhere, or how did they?
I'm not positive about the testing locations.
When did they?
There are a number of places where a person could be tested at this point throughout the state. So, you know, most of that information is handled at the state level. We are notified that, you know, if we have 2 positive cases, that will come to us from the state. But, you know, we don't have that level of information because much of that is handled outside of this department.
So you don't know if they were possibly treated at a local hospital here in Denver?
I don't believe that either one of them sought medical care.
So
Yeah.
what we can do now as well, one of our local cruise ship case was a companion with another traveler from a different jurisdiction. And we were already monitoring this individual because they reached out to us directly. We were able to go with a nurse to do in-home testing to reduce the risk of spread to any other locations.
Is that the Douglas County case when you say local jurisdiction?
I'm not sure actually which county that case is from.
Have you notified CDPHE and the governor's office?
Yeah, I've been in contact with the director of CDPHE 2 or 3 times today.
So Bob or Kaylee, so is one of these people the person associated with St. Anne's School?
No, I don't believe so. And Kaylee, can you speak to and please understand that, you know, what I have a number of staff members here that get into the details of these cases and keep me updated. But when we get into that level of detail, I'm going to have to refer to the people who are actually doing the investigations.
Yeah.
Yeah.
I will say that we do know that it was a presumptive positive that triggered the action of the school. We weren't involved in that decision that they made. But it is a presumptive positive case that was a parent of one of the students.
And so that's one of the 2 people we're talking about is a parent of one of the St. Anne's
Yes.
students. Okay.
Do we know which one that was? Was it the Vancouver one or the cruise ship?
I don't think we're prepared to go into that just so that we can protect some identities.
But it is one of them,
Yes.
is the parent of the St. Anne's student. Do we know when they traveled?
We have that information, but again, for privacy's sake, we don't want to share it just so that people can't figure out who these individuals are. But we use a system to determine at what point they traveled, when they became exposed, when they became symptomatic, and we can kind of backtrack from all of those to identify any type of risk period.
But just to confirm, one of these cases is the parent that was tested from St. Anne's.
Yes.
Are any of the people in quarantine showing any symptoms, A, and then B, is any of them in the older risk category?
I'm not positive exactly. So when we talk about the older risk category, we're looking at a real big range. We do have one older individual and one person who falls within the parent's age of a small school child. So approximately 30s or 40s.
Are you all concerned about the possibility of community spread here in Colorado? And do you know how many tests the city's public health department has?
Well, the city's public health department, which is this department, we don't do the testing. The testing is done at the state level. In terms of the first part of your question, is there a possibility for community spread here? Well, there's always that possibility, but we're working with our partners in the Office of Emergency Management to mitigate that and to manage it if that does occur.
Do you think there'll be more cases here in Denver?
I think we will see more cases eventually, but I'll leave it at that. We're prepared to manage it.
One of the big questions here, you did confirm that one of the individuals is one of the parents from St. Anne's Episcopal. We do know that they reached out to the state and they reached out to the city and they were told that they didn't have to let students go for the day, but they chose to. Is there a reason, especially when the CDC is saying that the disease could be spread even by touching surfaces, that the city wouldn't, advise them to let school kids go?
Well, yes, because just because a parent may be symptomatic doesn't mean that their child is symptomatic nor infectious to the point where they could infect others. We're talking about incubation periods and symptoms and exposure and the timeframes for that. So because we have a parent who had a student who went to a school, that student is not infectious. The timing for that isn't right. And so it was a decision the school made. It was not something that we had done. And it's, looking back in this situation, it's still not something that we would do.
So you wouldn't have asked the school to let students go early today? You wouldn't have chosen a different route or decision for them?
No, I wouldn't have done that. I mean, I understand it was a decision on the part of those making that in that school. I understand that, I respect it, but that's not something we would have ordered at this point in time.
And they both self-reported, you said. They both of these people came to health officials and said, we might be infected.
That's correct. I think with the way we're sharing information broadly about potential travel exposures, we get a lot of calls from folks that are concerned about it, and we are able to do some screening to determine if we need to follow up and do testing.
Have you contacted anybody else who they may have been in contact with over the last couple of days? Have you already made contact with them?
Well, we would have done that as part of the investigation. Everybody we needed to contact to maintain the situation, to control it, would have been contacted.
They've already been contacted?
Yes.
Has anybody else been, I think you may have already covered this, has anybody else been placed under quarantine because of relation to these two cases?
Yes.
How many people?
Well, I think just a couple. I don't know the exact numbers, but Kaylee, you might know.
We have 7 people total currently under quarantine, and when we say under quarantine, that means at home, just with restricted ability to go out into public spaces.
In addition to these two, or including these two?
These 2 cases will be isolated at home until they get negative test results back.
One of the big questions that I have as well is, why quarantine at home and not at a facility where there's medical doctors right on hand?
Well, first of all, there's no need for that. Let's understand that the majority of cases that have that come down with COVID are going to experience, some will experience no symptoms or very, very mild symptoms. For everyone who is tested positive that we place under isolation, they will experience symptoms very similar to influenza, but they don't need medical care. And so to send them in, unless it's acute, and so to send them into a medical care facility when they don't need medical care just burdens the medical care facility for those that do need medical care.
Kaylee, just a couple of things, I think somebody was just trying to clarify here. You said 7 people total were under home quarantine. Is that in addition to the 2 people, or does that include those 2 people?
The 2 people being the presumptive positive
Correct.
cases. So those are not counted as quarantine. Yeah, those are
Okay, so
home
the 7,
isolation.
those are 7 other people
Correct.
in addition to those. Okay. And you described one of them as being kind of a parent age, 30s to 40s, is the St. Anne one. Then you said the other one's kind of older,
Yes, so we do believe that they fall into the older risk group.
which is,
Well, let me answer that. You know, people who are at most risk are generally older people, you know, those that are 65 years or older present more of a risk in terms of higher risk or higher elevated symptoms.
so is it a safe assumption then the second person is 65 or older?
Well, I don't know that. The person the question was, is she older, or he or she older? Yes, I mean, but I don't know if they're 65 years or older, but that's the guidance. Those are generally the people that will monitor a little bit closer.
Is the child of the St. Anne's parent under quarantine? Or anyone else in that family?
And what's the status of that?
Yes, they are.
The
Okay.
family is,
Yes, out of an abundance of caution, because they are considered a close contact of a presumptive positive case.
So they're all at home?
Yes.
They're home. Okay. Are you content with CDHP's response to coronavirus here in Colorado?
Am I content with it?
Yeah, are you happy with it? Are they doing the right things? Do you think they should do more?
I think they're doing the right things. I think they're ahead of us. They're on top of it. They're working closely with us. If you would like more details on what they're doing, then I would direct that question to them.
Washington has procured, I think, an old hotel or something like that to quarantine people. Is Denver looking at doing anything similar?
You know, we are certainly preparing for the possibility that we might need to expand on our shelter system. I'm confident that our efforts are going to control this to the point where we won't need to do that. But we always prepare for the worst and hope for the best. And I think we're going to be able to manage this well, so that we don't have to take that step.
When it comes to the quarantine and isolation, the parent, for example, is in isolation, the family is in quarantine. Are they in the same place? Are they in different places?
They're allowed to stay at their home.
They're both in their home. That's how it works, I guess?
Yeah, I think that while we look at this, we want to try to reduce the burden on folks. So with the mindset that while this person is symptomatic, they're reducing their exposure to the family by limiting the amount of contact that they have, but obviously some shared living space, which is why we also quarantine the family.
Are you guys helping in any way, shape, or form, kind of, so they don't have to go to the grocery store or run errands or medical stuff that they need?
What we advise them when we issue them isolation or quarantine orders is that they're struggling with complying with those orders, then they reach out to us for guidance.
So nobody's calling them every day, checking in on them?
We do monitor them.
Oh, you
Yeah,
do? Okay.
yes.
And I just wanted to clarify, sorry, I know earlier we said 10-ish people met the criteria and were in quarantine. Was that later cleared up and it's 7 people in quarantine and then 2 people presumptive positive?
Correct.
Okay, just want to double check.
Do you think, should people in Denver change their plans this weekend about going to any events, going to the Nuggets game on Monday, or anything like that?
No, they shouldn't. It's important to understand, and we've said this many, many times, the best control at home, the best control in a public setting is to be aware of surroundings. If you have if you've been in contact with ill persons, then certainly contact us for guidance. But people don't need to start staying at home. They should be aware of, if they're in close contact with somebody who's coughing or sneezing, they should remove themselves from that situation. They should wash their hands with soap and paper towels before they eat, before they touch their face, their nose, their mouth, their eyes. That's critical here. And I want to stress that. I can't stress that enough because, it's human nature for, people to be out in the community touching things that everybody else has touched, and then they go out to eat and unfortunately sometimes forget to wash their hands, particularly when they eat out. And so it's really important, and we are working with partners throughout the city to get that messaging out. To wash your hands frequently throughout the day, and even more particularly, be sure to wash your hands before you eat, whether it's at home or in a restaurant or elsewhere.
When you say you monitor people under quarantine, what does that mean? Is there like a city official literally standing outside this person's home constantly? Are you guys calling them, emailing? How does that look like?
Yeah, you want to speak to that, Kaylee? I believe Denver Public Health, our partners at Denver Public Health are doing
So
that.
we use partners at Denver Public Health to support these actions, and it's definitely a case-by-case basis. Most frequent approach is going to be that people log their temperature or additional symptoms daily and report to us if they have fever or symptoms. There's another approach of us doing daily active monitoring where we actually reach out to them every day for a temperature report.
And that's like you're calling them?
Yep, we call them. And for more critical cases, and we haven't had to do this yet in COVID-19, or if we think that people aren't going to be compliant, we can arrange for in-home visits as well.
What happens if you have to be isolated, but you live with people? Are they automatically quarantined as well?
If they choose to remain there, yes. If people can make other arrangements before they become exposed while the person was symptomatic, they could remove themselves and stay somewhere else.
But it's not like you can choose to be, you can't live in the same place and then say, well, he's quarantined, but you're not, right?
Right.
Everybody in that house is quarantined.
Right. Everybody with the same exposure risk, exactly.
For the people who are infected, these 2 new cases, do we know how they contracted the virus?
Well, I don't know that we know that. It's very difficult, not just with COVID-19, but many infectious diseases. It's very hard to trace where you might have been exposed to that, given the nature of just being out in the community, the surfaces that we touch, the people that we come in contact with. That's very difficult to trace.
Did the family of the parent, did they also go on this trip with him?
I don't know that.
No, they did not.
They did not. Got it.
Bob, do you know how long it takes to get these presumptive tests verified by the CDC? And when will you know if it's in fact verified?
Well, again, 24 to 48 hours. When did they get sent?
So they'll likely get sent today or early tomorrow morning, depending on the courier service.
And so that takes 24 to 48 hours after that?
Yes,
That's
So
correct.
it'll be late weekend, Monday-ish?
correct.
Yeah.
Okay.
We understand that an employee of a real estate company was one of the ones that also contracted or presumptive positive for COVID. Do we know if he or she was practicing or touring homes?
I have no idea about that.
Yeah, I'm
The
not.
particulars of that, yeah.
Should anybody be taking any extra precautions if they're flying out of DIA over the weekend or the coming weeks?
Just standard precautions for travelers. Again, the airport is doing everything they can to make sure that hand washing sinks are stocked as they need to be. I believe they set up hand sanitizing stations. They're taking other precautions. But there's no reason for people to cancel their trips or to refrain from being out in the community this weekend.
Should there be any fear? I mean, all the shelves are being cleared out, at Targets, Costco's, face masks, medical stuff for your immune system, Germex. I mean, if you're going and you're out, what are some alternatives that you should be turning to if you can't find any hand sanitizer or anything like that?
Well, hand sanitizer, I appreciate the question because, there can be an impact from overreacting to the information that is going out on this. There's a fair amount of misinformation, and it's important to keep this in perspective. This has been equated to influenza, and with many that have made that equation, I tend to agree with that. And I think that puts this in perspective. And so hand sanitizer is only needed for people who don't have access to hand sinks, and we'll be distributing that to those people within our community that don't have immediate access to hand sinks. But the majority of the population does, and they don't need to be carrying hand sanitizer with them. Going back to what I mentioned earlier, they need to make sure that they're washing their hands frequently, and most importantly, before they touch their face and before they eat.
Is the city doing anything to prevent hotspots from happening, like homeless shelters, where you find the elderly, where people don't have access to sinks and such?
Yes, we absolutely are. We're pushing out a great deal of information to our homeless population, making sure that they know where available public hand sinks are, whether they're provided by or hand sinks out in the community, I should say, whether they're provided from the city or from the private sector. So that information's going out. We're working closely with our shelter partners to educate them on the steps that they need to take, and then we're distributing hand sanitizer as well for those that can benefit from it.
You've said that people don't need to be staying in or canceling events or anything like that. CDC guidance today said that people who are more at risk, older people with chronic health conditions, should stay at home. Do you agree with that?
I would like to look at that. I've been monitoring CDC's guidance, and to suggest that a person at this point in time can't leave their house and go for a walk in their community, I would disagree with that.
Even with, even if they're more prone to it, older, have chronic disease, anything like that?
Yeah, well, again, there are levels of risk here. And so just a blanket statement that should older people stay home and not leave their house. I would not provide that guidance at this point.
How about nursing homes? Is there any extra precautions that are going on with them?
The same precautions that were given to all the other facilities that we talked about. We're giving guidance to many private sector businesses, building and owner and manager associations, and we've been talking with members of the judicial system to see how they manage this if it becomes more of a widespread outbreak. But we're giving guidance to a wide range of businesses in the private sector, including those.
So what's next for St. Anne's Episcopal School? I mean, they released kids early today. Are they going to do any kind of sanitation protocol before they come back to school on Monday?
We'll be talking with them today about next steps. I have not had an opportunity to speak with them yet, but we'll be following up with them on next steps.
I know you talked about the Nuggets game, but I just wanted to briefly touch. Oprah's going to be in town this weekend. Does that have anything, should people be worried about it because large groups concentrated in one area?
People who are concentrated in large groups should follow the guidance that I provided. Be aware of their surroundings and follow the precautions that I mentioned in terms of their own personal hygiene. But beyond that, I am not at the point where I would recommend that people not attend a large gathering like that.
What happens in these cases? You have the COVID-19, you have the 2 presumptive positive cases. let's say they go through the 14-day quarantine process, they don't show any more symptoms. After 14 days, do you continue to monitor what's after the 14 days?
Well, unless there's been recent guidance provided by the CDC that I'm not aware of, it primarily business as usual. There might be some follow-up to make sure everything's good, but Kaylee, is there anything
Yeah,
recent from the CDC?
I'll add the differentiation that the folks that come back as presumptive positive are under a separate isolation and not quarantine. So the quarantine is for the 14-day incubation period for folks that might have been exposed to see if they do develop symptoms. If they run that course and they don't develop symptoms, then we release them from the quarantine order. Folks in isolation for presumptive positive, they have to get 2 negative tests from the of our COVID-19 test, 24 hours apart, to show that they are safe and no longer a risk to infecting others.
We have to wrap up. Any one last question? Anything? I guess one of my big questions in San Antonio, they released a patient who was negative, then came back positive. How are we preventing that from happening here in Denver?
Well, following the guidance from the CDC in terms of when a person can be released, I think there's some confusion about people who are being isolated and what happens to them, if they don't become symptomatic, and then what happens to people who are quarantined because they are symptomatic. I can't speak to what happened in Arizona, but we'll follow the protocols to make sure that that doesn't happen here.
Thank you.
Thank you.